There she is. Hello.
Hi, so nice to see you.
Yeah, likewise. How are you?
I'm great, thank you.
Good. Happy Tuesday.
Tuesday indeed, a hot Tuesday here in Southern California.
Yeah, no, it is a hot one. I'm here in Nevada and it's super steamy. In fact, it looks like it's gonna rain maybe.
Ooh, send that our way, please.
I know, right? I hear you. I hear it's needed everywhere.
For sure.
We need a good hard rain everywhere. I
Yep.
think everywhere in the world right now. So,
Hmm.
well, thank you for joining us. I appreciate it.
Yeah, my pleasure. I'm
Yeah.
excited.
Yeah, I know. Well, I was just, I don't know if you know too much about our Toolbox series, but it's something that we started just kind of reflecting. Well, really, me as a parent, I realize, I do better when I know better. And I certainly became a parent, didn't really know much. And so trials and tribulations, blood, sweat, and tears, figuring it out, winging it. We call it at Prince Lionheart, life's grand improvisation is raising kids. Uh, and so I figured, you know what could we do to help parents? And it's, I think, to find resources that can kind of inform them on topics that they may not know. Sometimes we only get there because we're in a place of need. We have to figure it out as we go. So if we could kind of build a library of resources, then I think it would benefit really any parent. So that's what we're working on. We're building a and you are one of our books on the shelf, and we're going to call it speech therapy today. So I like to start with everyone kind of just telling us a bit about how they found their path and how you, it sounds like you established McRory Pediatric Services and how you found your way along that path.
Yeah, absolutely. Actually, when I was in high school, I worked as a certified nursing assistant in a local nursing home. So I started off my path thinking I was going to go into nursing. And then when I went to college, I continued to work in nursing homes, but I didn't really like the fact that nurses didn't really get a lot of time with their patients. And one thing I really loved is that interaction and that relationship that you get to build. And so I went to my counselor on campus and he said, well, have you ever heard of communication disorders? And I'm like, no. And so I took an introduction course, and honestly, it was the first book in college I read from front cover to back cover, and I just loved it. And I knew at that moment that that was the destiny for me. So I was very blessed early in my career that I got to work in a lot of different settings, which is one of the wonderful things about being a speech pathologist. I worked in a public school, a private school, a nursing home, a hospital, inpatient, outpatient, and just that gamut of different places. And I really it just really reconfirmed that I really loved children. And so having had that opportunity to work in a variety of different settings, I decided that I wanted to create my own business. And over the years, I just grew my company based on parent need. So just
Yeah.
really what the community needed. We had families that would drive to one clinic for speech, maybe a different clinic for physical therapy, and then another clinic for occupational therapy. And then just thinking about that quality of life for families of all this time being spent in a car. And thought, gosh, wouldn't it be awesome to have a one-stop shop for families where we could collaborate as a team, really support each other, and really provide that, holistic service to our families. And so that
Yeah.
is kind of how McRory Pediatrics was born.
Oh, that's excellent. No, it is a lot of time. I know firsthand it's a lot of time going to all those different appointments, and it becomes certainly a journey and a process that is known to the child as well. And if you can make it easier and more fun, I mean, they see it as fun anyway.
Absolutely.
Just take away the less fun drive time. That's awesome.
Yeah, exactly.
I did see a lot of other services that you guys do or offer, which is great. Today we're talking about speech therapy, and it's something that I mean, it's not hard for me to put my parenting hat on because that's what I do every single day. But I usually try to think about, okay, if I happen to know a little bit more about speech because I've been on that journey with one of my kids. But for those who don't know, and for those we have, all kinds of people tuning in, whether they're parents already or expectant parents or different ages of their children. But I guess I try to do kind of like the mile high view first. So in terms of milestones, take us through some of them, from babbling to first word to two syllables to, two word sentences, blah, blah, blah. Kind of give every parent the general path in which development takes a child.
Okay.
That start.
Okay. Obviously, the first thing that children need to be able to communicate in words is they have to have sounds. So that's
Sure.
really that early babbling start. So very young infants will do what we call reduplicated babbling. They'll say like da, da, da. Well, they'll just repeat the same syllable many times. They, you know, and kind of emerging from that comes those first words, which is oftentimes that mama or that dada, or maybe they're just playing around with those sounds, but, you know, we want to attach that meaning to it, right? Over time, that babbling becomes a little bit more sophisticated. And a lot of times parents will joke like, they're talking all the time, but they sound like they're talking in another language, because it becomes more variegated and it sounds more like a conversation, but there just aren't words attached yet. So you kind of get that sound of where they're just making all these different sounds together, and it kind of mimics that same intonational pattern of having a conversation. And then kind of from there, what happens is, you know, you model a word, like maybe every time you put your child's shoe on, you say shoe, and eventually that day, that child will imitate you and say shoe. And then maybe the next time they say it on their own. So those first words really should be emerging around 12 months. And then there to about 18 months and actually 24 months. And as we continue to develop, of course, that vocabulary really starts to explode. So between like 12 months and 18 months, we really see this nice explosion of vocabulary, which really sets the stage for those two words to emerge. So at around 18 months, some children might be putting two words together, or they might be using more what we call a succession of single words. So they're starting to connect ideas together, but they're not quite connected in a sentence yet. So they might do things like grab your keys, walk up to you and say, mama, and then there'll be a pause, and then they might say go, or they might say car. So they're telling you this idea like, hey, mom, let's get in the car, let's go somewhere. But they don't quite have that sophistication quite yet to kind of combine all those together. But as they get closer to 2, that's really where you start to see those word combinations happening. And then obviously as they continue to develop, then you're going to get more vocabulary, utterances are going to get longer, and you're going to start to see, like around 3, you're going to start to see more of those grammatical markers. So you're starting to get like that ing on eating, which means it's happening now. You might get some of those plurals, like the understanding that 2 or more, we're going to add. So that those grammatical structures and things like that start to emerge around that 3-year-old range. The other thing that happens at around 18 months to 2 is not only are they starting to put words together, but they're starting to use their language for more purposes. When we think about a young child about 12 months, you know, they might wave and socially greet or wave goodbye. Often their language is going to be in the form of a request. They're going to be asking for things that they want in their environment, like food or toys. But then they get into that phase where they start to ask questions. They start to answer questions. They might ask for help. They might ask for more. So that's where we really see that pragmatic language really starting to emerge, where they're starting to use their language for more of a variety of different purposes.
Gotcha. Yeah, I hear mo, mo, mo a lot in our house.
Yep.
Mo, 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 all day long. Mo, mo. I've got an insatiable appetite on my little guy.
That's awesome.
Mo, mo.
The question, then everything is going to be why?
I'll take mo right now. All right. So, okay. So we go first babbling, and I heard somewhere that I loved it. They're speaking, but they aren't articulating. You know, when it comes to like kind of some of the, I heard it more in the light of more special needs kind of speech, where it was they were actually working with speech therapists and they were actually speaking, but not articulating. And that was just a really interesting tweak on perspective for a parent, right? That was just, it stuck with me in terms of speech, because for those who, you know, are finding themselves in the parenthood process, if it's your first, you probably don't have really much of an idea, right? I mean, I certainly didn't. Even when I had a gap, I forgot what it was and how to compare, and they're all so different, individualized. So I guess the next question is, okay, that's the general kind of progression. At what point does a parent worry when they're missing those milestones? Is there a grace period of, okay, you know, because every child develops at their own time. Is there a 6-month window, or is there any kind of like, at this point, if your child isn't saying their first mama, dada, or something like that, at what point does a parent worry? Given that every child is different and they're all, you know, blooming and popping if they're kernels at their own specific time, at what point do we worry and seek out the services of a speech pathologist?
Yeah, and I think that's why it's a difficult question to answer, because obviously every child is very unique, right? And there's so many things that go into speech and language. So to your point, you have language, which is using words
Yeah.
to communicate, but also there's nonverbal communication, right? The use of gestures. We know by 16 months, there's 16 gestures that children should be using. And children should be using those gestures to kind of augment that communication as that language is coming in. So in addition to that language piece, you also have that speech part, which is what you're referring to, which is that articulation, that ability to form sounds together to create clear words. So I think that often gets confusing to families. And then, of course, when you think about language, there's also that understanding piece. But
Yeah.
even for that piece, there's just that engagement and that imitation piece. So I think, from a young perspective, if your child is having a hard time with play, they're having a hard time engaging, they don't seem to be following directions, they seem frustrated by their communication, that could be an indicator that maybe there's a delay going on. If they have a lot of words but aren't putting words together yet, if they have 50 plus words and aren't putting those words together, then that would suggest that maybe, something is going on there. If they are, trying to put sounds together, but you see them really visually struggle, you kind of see that groping and that real great difficulty of maybe imitating the speech and language that you're modeling, that would maybe suggest that there's a concern. So we can look at those milestones to give us some insight, if they're not combining words yet by 2, if they're not saying first words by 15 months or so, those certainly can be indicative. But we also can look at those other things, which might be more prevalent a little earlier on than when those first words emerge. And one thing that I always tell families and encourage them is, we play all day with kids. Kids have fun in speech therapy, and doing a speech and language assessment isn't an invasive procedure. It's something that kids really like. And even if anything else, it just gives you as a parent that peace of mind to know, awesome, my kid's on track. Great. Then you have that reassurance. And then that speech therapist can kind of let you know during the assessment of kind of what are those next milestones that your child should be hitting, and what are some things that you can do to encourage that. So if nothing else, you have that confirmation that things are okay. And now you have some tools, as you were talking about earlier, in your tool belt to really help kind of foster that development. And, worst case scenario, there is a delay, then you're getting that help. And what we know is that the earlier we intervene, the better the outcomes. Because what we also know is that delayed speech and language is correlated with later academic challenges. So if a child has delays in speaking and understanding, then they're at risk for having difficulties with writing and reading later in school. So again, another reason to sort of jump on it quickly so that we can sort of prevent further challenges down the road.
Okay, interesting. All right. Let's see. So with regard to a speech therapist, I know that there is a program, I believe in most states, that kind of does early intervention before the age of 3. Now, if parents do have a little suspicion that something may not be developing, or there may be a speech delay, are they able to go to a center like yours without first being referred to by a pediatrician or something, if they have that nagging feeling? Because sometimes, you take your kid to the ped, and you say, hey, I'm a little bit worried about speech, and they're in there for 5 minutes, and what do they, see? But sometimes that's not, enough for a parent. But are they able to see you guys without a referral? Or how would you recommend parents who have a little sinking suspicion that they seek out help?
Yeah, that's a great question. And I think it probably varies from state to state. So I obviously am most familiar with California, since that's where I am. To be able to do an assessment, we do require a prescription from a pediatrician, but
Okay.
so oftentimes parents will need that prescription. But most centers, I would assume, at least we do, if a parent calls and they have that concern, then we just make a call to the office of the pediatrician's office and say, hey, we got a call from this family. We'd like to conduct a speech and language evaluation. Would you mind writing a prescription test and faxing it over? So oftentimes centers will take care of that piece for parents, just to try to make that a little bit of an easier process. But typically speaking, an assessment is generally covered by insurance, as well as those early intervention programs that you were referring to.
Sure. Okay. Are you able, I don't know the answer myself. What can cause speech delays? I know you call them communication disorders, as kind of an overarching topic, because I know, there's stuttering, there's all kinds of different things, but is there any overarching kind of cause, some brain related, or, I don't know. Is that something that you guys can speak to a little bit?
Yeah, absolutely. So again, there's speech and there's language. So I'll just kind of lump them both together just for the ease of the conversation. Often if there's a family history, then that's going to put an increased risk factor on a child having a delay. So if they have a parent that had a speech or language delay or learning disability or dyslexia, that may cause an increased risk factor. Doesn't mean that your child will be delayed, but it's just a risk factor to know. You mentioned fluency, same thing. If there's a family history where a parent was a stutterer or is a stutterer, then that's going to increase that risk factor. We also know that boys are more prevalent to having delays than girls. But other things that could cause delays would be things like a prematurity, a hearing impairment, having another type of disability like Down syndrome, autism, cerebral palsy, having a brain injury at birth, like a stroke or, a traumatic brain injury from a car accident or things like that is going to cause a delay as well. Sometimes it's unknown etiology. Families will come and they have no family history and they don't know why. We certainly are seeing an increased risk right now, or not increased risk, but increased number of little ones coming in after this pandemic. And I think that's more of an environmental factor. I think just, parents are keeping their at home. They're not getting that same exposure to other children at daycares. You're not taking them to the grocery stores and using all this enriched language. When they are seeing other people, they're missing so much information from the mask. And
True.
these are kids who, for the most part are catching up rather quickly, and it seems to be more environmentally, impacted. But those would be some potential reasons. Of course, there's other things too, like a motor speech disorder that could be associated with cerebral palsy, but there is another one called childhood apraxia of speech, where it is a neurological, the brain kind of knows what it wants to say, but when that message is being sent to the articulators that control the jaw, the tongue, the lips, the respiratory system, the voice, the vocal cords, that's being disrupted, and that's causing a speech problem, which of course, if you can't make sounds, then that's going to cause a language delay as well.
Sure. Oh, that's interesting.
You can have one without the other. Or you can have one that causes delays in the other as well, like in that last example that I provided.
Interesting. I also learned in my parenting journey that chewing food actually helps speech because you're actually working the muscles that you use for speech. So masticating contributes to speech. And I just, these things that I don't spend any time thinking about as a parent. And then I end up at a GI doctor and they're like, no, actually we should, avoid the purees and go to solids so that we can actually work those muscles for speech. And I'm like, well, that makes so much sense when you say it.
I know, it's crazy. It's honestly, it's a miracle that anybody learns to talk. When you think about the complexity that it is,
right?
It's like, wow, who knew? I had no idea until I became a speech pathologist.
No, it's really true. And then you see little ones who are actually learning multiple languages or being spoken to multiple languages in the home. I've heard it, and maybe you can speak to it. Sometimes you see a little bit of a delay, what you would think is a delay, but then when they start speaking, they're speaking in full sentences, and it just takes them a little bit, longer because they have so many languages to kind of categorize and figure out. I mean, it's amazing.
I mean, amazingly enough, the research does support that whether you're a bilingual, trilingual, or monolingual, growing up in any of those different scenarios, that you should still reach your speech and language milestones within those same
parameters.
Right. So we know, like with any development, right, there's this big gap. Like you should walk between this and this. You should speak between this and this. So you might be like what you were saying, like more on that tail end of like the later part, but you should still be hitting those development. Yeah.
All right. So is there anything that parents can do at home, whether or not they've detected anything? I mean, I guess the obvious is speak to your child, right? And do the repetitive things that, shoo, hot, stuff like that. But is there anything else that you can recommend that, is good practice for all parents, whether or not there's a speech delay?
Absolutely. Going back to your question about being bilingual or having more than one language in a household, I think it's really important to try not to mix those languages. So if I'll use Spanish for an example. So if you're in a house that has English and Spanish, in some activities, just speak just English. In other activities, just speak Spanish, but don't mix them and say like, you want agua? Some English and some Spanish, not mixing them, but keeping them separate is helpful. Some families, one parent might speak all English, the other parent might speak all Spanish. That works well too. I think too, the other thing is just, you know, when you are interacting and playing with your child, just trying to be face to face at their level is really important, because there's so much information that's conveyed about meanings of words from our facial expression, but
Mhm.
also speak and we're face to face with our child, they can really see how those sounds are formed. So that would be a basic strategy, that when you are interacting and you're on that floor with your child, you know, think about their little bodies being here and then we're towering above. So we might have to lay on our bellies so that we can really be face to face. So I try to break it down for families and say, think about being eye to eye, nose to nose. So you're really at their level. The other thing too is I think we talk to our children a little bit differently depending on what we're doing, right? When we're changing our child's diaper, we're trying to build understanding. So we might use really long utterances. Oh, your diaper's wet. Mommy's changing your diaper. Oh, no, it's going to be so cold. And we're using all this enriched language, which is great. But if our goal during play or book reading is that we want to set the occasion for our child to imitate our language, then that's where we need to simplify. So if our child isn't yet imitating our speech, we want to give them a simple model. For
Mhm.
example, if I'm stacking blocks and I'm saying, oh, you're putting the big block on the tower. Oh, there's the red block. It's getting so tall. Oh, no, it's going to fall over. Our child will probably be pretty silent because they don't know what
Right.
word to extract from that. But if I'm playing and every time I put a block on, I say on, and I wait with that expectant look, I'm
Yeah.
setting an occasion for my child to anticipate that word on, and they might fill in by making a sound or they might say a word. So keeping our language just kind of at their level. So when they start using single words, that's when we can start modeling two-word phrases. So we're just kind of always speaking one word
Sure.
above
Huh. That makes sense. I realized that I taught my son stinky.
That's a fun one. That's a fun gesture too.
Now I actually ask him, I said, do you have a stinky? And he'll go like this, and then I know he's pooped.
That's great. That's great. And that's wonderful. I actually was listening to one of your lives that you did recently with other speech therapists, and you know they brought up a good point, and you just kind of brought it up too, is using sign language. You know, there's a lot of great research that's been done on using sign language with just typically developing children, and how it really increases their vocabulary, and even more importantly, it really reduces some of that problem behavior and frustration,
Right.
can tell you when they want their milk, or they can tell you when they want more. Interestingly enough, by the time, what they found is children that learn sign language, coupled with just their regular home language, by the time they hit kindergarten, their vocabulary kind of equaled out to their speaking peers. But during those early years where children have lots of tantrums and they get very frustrated when they can't communicate their wants and needs, it can be a really powerful way that's easy for them to acquire, because you know, this system here is pretty difficult when you think about it. It's a very fine motor skill. So, you know, we can't expect a 6-month-old to be combining all these sounds together for speech, but they might be able to do some simple sign approximation.
I've actually found that is, I mean, I studied sign language in college, which is amazing, but I've done it with all of my kids, and we're able to, I'm always able to understand them, and they're able to understand, they understand a lot more than I think most people give them credit for, myself included, but they get it. And then as long as we're able to communicate, it really does reduce the tantrums and the, you know, the frustration. Because can you imagine? I mean, all we have to do is go to a foreign country and,
Absolutely.
and we're like right back in our baby shoes. You know, it's whoa, everything coming at me. And if someone were to slow down and get eye to eye and nose to nose, weird, probably have a better chance of understanding.
Right. It's a step in the right direction.
So true. So someone asked that, said that their I just did it. Their toddler stutters sometimes. Is that something that they should be concerned about? I think I heard, I don't know if it was a credible source or not, but sometimes they're thinking so quickly that sometimes they can get caught, and it's just kind of a developmental thing that can pass. But then when to worry, and is that even true? I don't even know. It's just something that I have in the wrinkle of my brain.
Yeah, you have it. You should trust your wrinkle.
Okay.
That between 18 months and 3 years of age, there is a period of time that children will exhibit or may exhibit, not all children, but some children may exhibit some normal developmental disfluencies. And to your point, it's kind of that idea of like they have all these thoughts and ideas and they're trying to organize them all and find the right words and all that. Typically, when it is a normal developmental disfluency, what you'll find is that they might have some disfluencies or some stuttering on some days, but maybe not all the time. They also at that stage just typically don't even notice it. They don't pay any attention to it. It doesn't really bother them. Um, they might repeat like a whole word. They might repeat a part of a word, but it's really kind of not that big of a deal.
Mm-hmm.
After 3, then it can turn into, it can still be a normal developmental disfluency, but things that would make us more concerned is when a child is starting to avoid talking. They're avoiding talking situations, or they start to say something and then they get stuck. And then the parent might say, no, Johnny, what were you saying? And then they say, oh, never mind. So they just kind of give up on the speaking, or they start to show a higher rate of frequency of when they're emitting those stuttering behaviors. So now it's happening more consistently. It's happening more regularly. There aren't as many dry spells. And then, of course, we become really concerned when we see any kind of secondary characteristics. So that might be something like a facial grimace, or like I just evaluated a little guy who's 3, and he's doing a lot of like eye closure when he gets stuck. He gets very visible stuck, and you start to see that tension in his face and a little bit of an eye grimace. That becomes a little more disconcerting. And again, kind of going back to that history, again, if there's a parental history of stuttering, then that does increase that risk factor for that child potentially stuttering as well.
Oh, interesting. Okay. Wow. So a question for you. I imagine a lot of your kids who come to speech therapy may also be receiving some speech therapy in school. Is that something that you think kind of more is more and better, or is it something that I guess the question is in my mind is more and better, or is it kind of not?
Yeah, I think that's a good question, right? Because we often, as parents, we want to do everything for our children to help them be successful. And sometimes we might see recommendations for all these services, and then we feel like, oh my gosh, this child's only 4. Does he really need all this intervention? Where's the time to be a family? Where's the time to be a kid?
Right.
It is difficult sometimes to find that balance, right? It's not always about the quantity of service, but maybe more about the quality of service. And I think it's a difficult question to answer, because I think it kind of depends on what the core issues are with the child. In the school districts, unfortunately, they're plagued with very large caseloads. And so oftentimes what happens is everything's done in a group. There can be wonderful times for group because there's that peer modeling. If you're working on pragmatic language, it's great. If you're starting to working on speech intelligibility and your peer across from you can't understand you, there creates some intrinsic motivation to work on your speech. So there can definitely be some powerful benefits of group speech. But if a child has more of a significant delay, if there's something going on with that motor speech, like an apraxia of speech, and again, depending on what approach the SLP wants to take, sometimes one-on-one services will be more beneficial. There are some techniques for kids that have more speech difficulties where the therapist might need to touch their face. Some school districts won't let SLPs touch their face, right? Or if there's feeding issues, oftentimes schools won't allow the therapist to work on feeding therapy, and then you've got to go into a private clinic. So I think it kind of depends on what the core challenges are to really answer that decision. But we certainly have had kids that have come here where we're saying, what, we think you're ready just to do your school-based, you're great. There's other times families are doing both, or families that have tried the school and it just wasn't individualized, and so they ended up going into the private sector as well, or instead of.
Gotcha. All right. Well, interesting. Was there any common kind of frequently asked questions that you get from parents that we haven't covered today that you want to address, or any messages to parents who find themselves tuning in?
Yeah, I don't know that I think I'd like to do that. I think I'd like to say a message. I think, oftentimes what parents struggle with is really understanding their role in the therapy process. It's really important. We know that parents have the closest relationship with their child. They are going to be able to make the most impact on their child's development. Coming to speech therapy twice a week for an hour or 30 minutes is really not going to be enough. So I really like to think of parents as an integral part of the team. You're going to be an honorary SLP. You're going to be in the room with me. You're going to be learning the strategies. You're going to be rolling up your sleeves, getting on the floor. You're going to be practicing them so that you feel empowered to practice at home. So it's just really important to understand and embrace that process and ask questions. And if your speech therapist tells you to go wait in the waiting room, maybe question that and ask, can I come in? Because it's really going to have much of a better outcome the more involved that parents are. And I think too is just really asking therapists how to make the most out of the everyday routines you already do with your child. You know, you don't need to sit down at a table and do a worksheet for 30 minutes to practice speech and language. You just need to maximize everything that you're already doing, you know, bath time, reading book time, play time, meal time. There's just so many wonderful, easy to use strategies that you can just embed into those natural routines, and that can have a really big impact on your child's progress.
And one thought with regard to screen time and speech, because I think there are some, you know, shows out there, content on screens that I know during COVID, when we were all charged with being our child's speech pathologists at home, which is just add another hat, right? We found something called Miss Rachel. She was a preschool teacher, and she would sometimes go like up and, you know, like, ooh, you know, whatever, doing the touching. Is there anything, because we also, in another toolbox series, we were talking about kind of studies where it's such a rich environment, the screens, and then it makes kind of the faces of normal people boring. So do you have any thoughts on that? Is there any enriching content that would be seen as a positive as opposed to detracting for parents out there?
That's a good question. There is more and more research coming out with high usage of screen time and its association to ADHD and learning disabilities and things of that nature. I believe, and whoever's watching this, you know, look this up, because I may be incorrect on this, but I feel like there was a recommendation made recently, no screen time for children under 18 months. So much that it's about the quality. I mean, obviously, if you know, listen, we all have to cook dinner. We all have to do laundry. We have to do things. And sometimes you do have to put the screen in front of our child, and that's okay. And we shouldn't feel guilty about that. And so I do think that when we find ourselves in those scenarios, it's better to provide those quality programs like you mentioned versus not. But obviously, you can't replace that one-to-one interaction time that you have with your child. That's obviously going to be much more meaningful to your child than watching something on a screen. I have seen some children pick up some nice vocabulary when watching those types of shows. One thing to consider when we think about the vocabulary that we're teaching our children, whether it's through an app or a show or pictures in a book, is really making sure that we're providing exposure to a lot of different vocabulary. I see families focus a lot on nouns, right? The labels of things, which makes sense. But when we're getting closer to the stage where we're wanting to combine words, it's not going to make a lot of sense if I say milk, cat, book, right? I'm going to need other vocabulary words like verbs or action words. I'm going to need prepositions like on, in, under, up, down. I'm going to need, you know, descriptor words like red or big or wet in order to combine those words. So just a little tip, like when you are really working on providing those nice language models for your children, don't ignore those other words. Don't just do the nouns, because that will be a barrier when your kiddo's ready to start combining those words.
Good tips. Well, we appreciate it, Nikki. Anyone who was able to join us live, anyone who's going to be watching this, you can find Nikki at McRory _Pediatric _Services. So check it out, and thank you very much for your time. Appreciate it. Learned a lot, and have hopefully gave everyone a lot of takeaways. But if they have any questions, they know where to find you. So thank you very much. Appreciate it.
My pleasure. Thank you so much, and kudos for you for doing this wonderful toolbox. It's a great service for families.
Well, thanks. Well, hopefully it's helping folks. I know that when I figure it out, I end up doing better, or I just have more mom guilt if I don't.
Oh, don't do that.
No, great. I've gotten so much out of these just by asking questions. So thank you very much for being one of our resources.
My pleasure. Take care.
You too. Bye-bye.
Bye.